Welcome to HealthManagement.org Decision Support Community Talk. We welcome our Editor-in-Chief IT, Professor Werner Leodolter. Would you mind introducing yourself in brief?
Well, I'm a professor for applied management in healthcare at University of Graz and Chief Information Officer of Kages. I also served for 5 years as Chief Executive Officer of this company. We are running 23 hospitals, and I'm also author of books on decision support and digital transformation. And I'm co-founder of a company concerning this, decision support systems.
How would you define clinical decision support, and what tools fall under the umbrella of clinical decision support?
Well, the computer assists the doctor or the nurse in the use of available data by providing relevant information, by giving warnings, by detecting and maybe categorizing and quantifying suspicious areas in images from radiology, from pathology, from dermatology or gastroenterology, and so on. There is a broad field where you can apply clinical decision support.
What are the most important factors considered by healthcare providers and, of course, healthcare staff when evaluating a clinical decision support system?
Well, the most important factors are that these clinical decision support tools should bring benefits for the patients concerning patient security, but also benefits for medical staff concerning more efficiency by saving time for retrieving information, but also more quality of decisions by providing a better basis for clinical decision making. On the other hand, we have to consider the risk for an organization when computer-assisted decisions go wrong, and, for example, malign lesions and cancer are not detected. So you have to consider the pros and cons, and evaluating that, you have to take the decision what you use for decision support in your organization.
What benefits can healthcare facilities and, of course, healthcare providers derive from clinical decision support systems?
Well, I think saving time for searching and finding relevant data, saving time in the interpretation of these data or these pictures, these images. It's freeing time for the interaction with patients, and by freeing this time for interaction with the patients, you also motivate your staff.
What are the primary criteria for doctors to be able to trust and adopt decision support tools? And in general, how can we trust decision support systems, and how can we increase this trust?
Well, those algorithms clearly have to be validated. Where appropriate, they have to be certified as medical devices. And wherever possible, they have to be explainable. They have to be explainable for the user, for example, by providing clinical parameters of the patients that are indicating a predicted risk for the patients. And by providing these parameters, it supports the clinical reasoning of the doctor or the nurse. And This explainable AI is a prerequisite from my point of view that it's also trusted by the staff. And if staff does not trust in clinical decision support by AI, they won't use it because they are finally responsible.
It seems that there is no doubt that the future of healthcare will be driven by an intelligent mix of human and computers and of course technology. What major trends do you foresee?
Well, I think a time will come when it will not be state of the art anymore to make no risk profiling based on available data, or to get no second opinion of the computer when assessing pathology images and so on. So the interpretation of genomic analysis is not possible without computer. So and all those new features concerning microbiome, proteomics, and so on, you require assistance in decision making. So it will become state of the art in the everyday business. It's not there yet, but the time is not too far.
How do you think this collaboration between humans and machine can be optimized? And how can healthcare efficiently benefit from the cooperation between humans and technology?
I think we are moving towards, let's call it hybrid intelligence, like I described it in my book about the subconscious mind of organizations. You have to deliberately design and define these hybrid intelligence. Hybrid intelligence is the good cooperation between artificial intelligence and human decision making, always under the aspect that the human factor is in the driver's seat and that artificial intelligence plainly assists. So when you look at the organization as a whole, you have to shape some sort of subconscious mind of this healthcare organization and provide excellent processes, controls, and checks in this new hybrid world. Otherwise, you won't get the benefits we already spoke about.
The COVID pandemic revealed significant weaknesses in healthcare systems all around the world. Do you think that decision support tools can help to increase operational effectiveness in healthcare in the future?
Well, I think there is a good chance. And for example, when you take COVID, it would be able, from my point of view, to identify for a patient his risk for a severe illness after COVID infection, or even of the necessity for an ICU bed. This will be predictable, and those at risk can be closely monitored at home and provided with special medication that's already available. And the transfer to the hospital is then finally very controlled, and only those who really need help then in time transferred to the hospital. And this idea that I described around COVID now will also be applicable for other diseases with the new possibilities that we have with home telemonitoring, with lab on a chip for diagnosing blood and so on at home. So there are multiple opportunities in combining telemedicine, telemonitoring with artificial intelligence and clinical decision support tools.
How do you think clinical data can be better utilized? Just what key points would come here to your mind?
Well, currently we have some obstacles here, especially in the center of Europe, Germany, Austria, because there is a high sensitivity concerning data privacy. And the way that the GDPR is interpreted. When you look at the northern countries, they're facing the GDPR. They found good solutions to enable the secondary use of clinical data. In Finland, in Estland, in Estonia, in Finland, and in Denmark, they are far ahead of Germany or Austria, for example, in this respect. And just have a look at their legislations and their organizations, like FinData, the respective agency in Finland. And there is full compliance with GDPR.
You have mentioned in this context as well artificial intelligence. Now, do you think there are threats or risks associated with this artificial intelligence, which actually increases the dependence on it significantly?
Yes, there are significant threats. Just imagine a young doctor who always says yes to the proposed decisions. And he does this for 10 years without making extensive clinical reasoning around it. Just saying yes, because he has the feeling that he's not responsible because the system is provided by the organization. Maybe he doesn't do this clinical reasoning due to his workload. So it's not a machine for artificial intelligence and clinical decision support systems, and not a machine for saving time of clinicians as a whole, but it's more an opportunity to, as I mentioned before, to free time for the clinician, for the patient. But let's take this young doctor saying yes for 10 years. Do you think he will have enough self-confidence? I don't think he will have enough, and he won't be a good doctor then. So you have to organize it right in your clinic, in your organization, that this does not happen. You have to give enough time for clinical reasoning and to think about the decision support and to give feedback for the doctor, a possibility to give feedback for the doctor when he thinks it's wrong, the prediction is wrong, because that can be. By this way, you also can detect biases or things like this. Don't use your decision support systems, don't use your AI without continuous monitoring.
You mentioned that you were the CEO of the largest hospital group in Austria, in Styria. When we implement or install decision support systems, then they clearly come with a price tag. Do you think it's worth taking the money in the hand and investing into this new system?
Depends on the price tag and depends on the use case, or the scenario in which you use it. you clearly have to validate and check how does it fit to your decision pathways and to your clinical pathways, to the quality of imaging you have. So you need when you are with clinical imaging, using decision supporting clinical imaging, then you have to consider big scanners for pathology slides and so on. So you have to look at it as a whole. What do you already have, for example, in pathology for enabling remote assessment of the images? Then it's not so far to take the step to take these digitally available images to run it through an AI, maybe in the cloud. So the price tag is not only the price tag of the provider, but it's also the price tag of the implementation as a whole. And there you have to consider what's my benefit and what's the benefit for my patient. And I'm convinced that it will be affordable in the future. And as I said before, the time will come when it's not state of the art anymore not to use this. So it will come, and there are many startups and so on the way to provide good solutions, and they have to be certified in certain points, and these are very many. They have to be certified as medical device.
Basically, if I'm running a clinic or a clinic group and I decide to make this investment and to optimize my workflow, optimize my safety, my efficiency, do you think it's a wise decision to go with a clinical decision support system?
I think it's a wise decision, and the clinical decision support system will not be one system alone that covers all those features. You have to compose what you need and where it fits to your processes and to your pathways. So basically, I say yes to your question, but don't expect one decision support tool for all my needs in the clinic.
Is there anything else what we may have not covered? Please feel free to add anything what would come to your mind.
As I expected when I started with risk prediction and risk profiling in our hospital group, I thought you need really big data for that and to get good predictions. We finally found out that you don't need so much data. It works the other way with less data too, when they are good, very well curated and there is also a possibility to come to federated learning. We are already experimenting with that. What does that mean? You make an algorithm, for example, for the prediction of delirium in one hospital. You make it in another hospital without the data of the patient leaving those hospitals or hospital groups. And then you combine these algorithms in the way of federated learning and get even better algorithms. So there are coming up new possibilities and new features, and we are working on that in the company that I mentioned before, where I am a co-founder, that's Predicting Health. It will be very. I'm very curious what will come up in future, and there are a lot of possibilities, and it will be a very dynamic development that is ahead of us.
Professor Leodolter, in the name of the HealthManagement.org team and the decision support community, we would like to thank you for this great talk, and it was very, very insightful. Thank you very much indeed.
Thank you for the opportunity.